Hello, I'm Dr. Jonathan Amspacher, and I'm a board-certified plastic surgeon. And I'd like to take a few minutes today to kind of talk and answer some questions that you might have about tummy tuck or abdominoplasty. Tummy tuck is a very common procedure that we do nowadays that helps relieve and improve the shape of the abdomen. And I have a lot of folks that tell me, I've worked hard, I've lost weight, I've gotten in shape, but my abdomen just hasn't sprung back to the shape that it used to be in. And part of the reason that is because if we have an expansion of intra-abdominal contents, it can be either from weight gain, weight loss. Pregnancy is the most common one that I hear about, and it separates the muscles, which are called the rectus muscles. And those are the vertical muscles that give us what we think of as a six-pack classically. But what is between the rectus muscles is a fascia. And what happens is this fascia sometimes can be stretched out by increased intra-abdominal contents. And even though we lose weight, we have pregnancy, it never quite snaps back to where it used to be. And so what we have is a very powerful procedure that can help improve the abdominal contour. We can also help reduce and shape the abdomen, sides, hips, and back to a great degree with adjunct procedures, which can be a little liposuction with an abdominoplasty. It all depends on where the patient starts out at beforehand. And I always tell folks, you want to get in your best shape that you can be in before having the procedure, because it'll greatly improve the results that we get. I generally tell folks you want to get to where you have a body mass index, which is 30 or below, because that's going to allow me to get the most pronounced and profound results and get you the nicest outcome. If you have a body mass index above 30, then you usually will have more fat that's around the internal organs and in areas that I can't work and remove it from, and so you'll still have a protuberant or pooching belly that I can't improve. And so I think to get the nicest result, we want to get you to a body mass index of 30 or below, and then we can really make some profound improvements and get a really nice contour. And so when you look at the procedure, it's a very straightforward procedure. It's removal of some skin from below the umbilicus in most cases down to the lower abdomen area, and it has an incision that usually runs across from hip to hip. And we'll show you some pictures here in a second that kind of show you where the incisions will go and what kind of a difference that we can make in patients before and after they have the surgery. And so we'll start first with a very nice lady who had children. She wanted to do something for herself. Her kids had been raised, and she goes, I want to do something to take care of myself now that I've made it to this phase in my life. And so she had lost 30 to 40 pounds, had gotten her body mass index down to 29.6 or so, almost 30, and she had done a very nice result. And so what we did was we did a full abdominoplasty with a little liposuction, and you can see the improvement that she has in the contour. It's almost like a whole different person because it made such a dramatic and profound improvement in her contour. Here's a lady that's in her 50s, has an abdomen that most people in their 20s would die for. And so it can make a really profound improvement. And so I wanted to take a second here and show you another case study. And in this case study, it's a patient who's very fit, works out very hard, but it had children and abdomen never quite sprung back to where it was. Even though the body mass index is down to 23, she still had excess abdominal skin and abdominal stretch marks, as well as loose, flabby skin that she couldn't get rid of no matter how hard she worked out. And so here she is afterwards, and you can see it's just a pronounced, profound improvement. We've restored the shapes, the curves, has a beautiful looking abdomen, and it's really a nice improvement that we can get with a procedure that no matter how hard you exercise, sometimes you just can't get to without the things that I can do in the operating room to make the improvement in contour and shape that really make a beautiful abdomen that we think of.